Hello everyone, good morning. I am Dr. Himabindu. I am a consultant gynecologist at Ankura Hospital, LB Nagar, Hyderabad. As October is a breast cancer awareness month, I would like to share few important things about the breast cancer. Breast cancer is the second most common cancer in female and one of the major causes of death in female. Risk factors for breast cancer: obesity and genetic factors. The women who are having BRCA1 and BRCA2 genes are more susceptible to get the breast cancer. Genetic causes: if the patient has a strong family history, if the mother suffers from breast cancer, the chances of getting cancer her daughter is more. Consumption of tobacco and alcohol and early menarche and late menopause, these are all the risk factors for breast cancer. On the day of examination, first patient has to inspect her breast thoroughly. Any abnormal change in the size or shape or any abnormal lesions, first they have to inspect. Any abnormal discharge from the nipple also patient has to check. With the pulp of 3 fingers, patient has to palpate the breast. It has to be done clockwise. By applying little pressure over the breast, patient has to palpate whole breast thoroughly to know any abnormal lumps present. Don't forget to palpate the armpit. If any abnormal lesions are present, immediately patient has to consult her physician.
Hello everyone, నేను డాక్టర్ సత్యశ్రీ, కన్సల్టెంట్ ఆబ్స్టెట్రిషియన్ గైనకాలజిస్ట్, అంకురా హాస్పిటల్, ఎల్బీ నగర్. ఒకవేళ మీరు బ్రెస్ట్ ఎగ్జామినేషన్ చేసుకునేటప్పుడు మీకు కనుక లంప్ తగిలితే మీ చేతికి, నెక్స్ట్ ఏం చేయాలి అని. ఫస్ట్ థింగ్, డు నాట్ పానిక్. భయపడకండి. మీ దగ్గరలో ఉన్న మీ సమీప గైనకాలజిస్ట్ కానీ ఒక బ్రెస్ట్ సర్జన్ని కానీ మీరు సంప్రదించండి. సో బ్రెస్ట్ లంప్లో రకాలు, బ్రెస్ట్ మాసెస్లో రకాలు ఏంటి? చాలా వరకు 90% ఆర్ నాన్ క్యాన్సరస్. యంగ్ ఏజ్లో వచ్చే 90% ఆర్ నాన్ క్యాన్సరస్. బట్ 3 to 4% ఇన్వేజివ్ క్యాన్సర్స్ అనేవి లెస్ దాన్ 40 years, అంటే లెస్ దాన్ 40 ఏళ్ల లోపల వాళ్ళలో మనం చూడొచ్చు. ఈ 3 to 4% వాళ్ళని నియంత్రించడానికే ఆల్మోస్ట్ 25 years ఆఫ్ ఏజ్ నుంచి అందరూ సెల్ఫ్ ఎగ్జామినేషన్ చేసుకోవాలి అని చెప్తున్నాం. ఎందుకంటే ఇవి ఇన్వేజివ్ క్యాన్సర్స్, అంటే తక్కువ టైంలో మోర్ విగరస్గా స్ప్రెడ్ అయ్యి ఎక్కువ డెత్ రేట్ని పెంచే క్యాన్సర్స్ ఈ చిన్న ఏజ్లో వచ్చే వాళ్ళకి ఉంటుంది. సో దిస్ ఈస్ ద మెయిన్ టార్గెట్ ఏజ్ గ్రూప్.
Hello, this is Dr. Sailaja from Ankura Hospitals for Women and Children, LB Nagar. This October we celebrate as a breast awareness month. So this is to make all the general people aware about the breast cancer and the symptoms regarding breast cancer, and also how to prevent these breast cancers. Prevention is always better than cure, and early recognition of the breast cancers is also possible by self-examination and regular mammograms. And prevention, talking about the prevention, maintaining a healthy lifestyle, avoiding non-vegetarian diet and alcohol consumption to be limited, good physical activity, and breastfeeding the babies would also reduce the risk of breast cancer. And self-examination, regular self-examinations and regular doctor checkups with mammograms would reduce the occurrence of, it helps in early detection of breast cancers.
You never know how strong you are until being strong is the only choice you have. Don't worry, I am with you in the battle. I am Dr. Alekhya, consultant gynecologist, obstetrician and infertility specialist, Ankura Hospital, LB Nagar. Breast cancer is the most common cancer among women in India. It is the second most common cause of death in the world. 1 in 8 women are already affected with cancer. So, know your risk factors: alcohol consumption, obesity, ethnicity, age of women above 50 years, and the most important is family history. If your mothers, sisters, anybody affected with breast cancer, please come over and consult your doctor. Can we prevent breast cancer? Yes, we can, by undergoing annual mammography test in the hospital, and the most cost effective is your self breast examination.
Hi, I am Dr. Archana, consultant Ankura Hospital, LB Nagar branch. As you all know, we see an increasing trend in the number of the breast cancer cases. At present, India ranks 3rd after the China and US in the breast cancer cases. At present in India, 1 in 28 women have the increased risk of breast cancer occurring during their lifetime. We see the increasing risk factors which are due to the increasing age, and the inherited mutant genes like the BRCA1 and BRCA2, which also causes the risk of the ovarian cancer, and many of the lifestyle modifications like the sedentary lifestyle, increasing consumption of alcohol, smoking, and obesity. Symptoms which we see usually, the breast cancer symptoms which we can notice by the self-examination, like if there are any changes in the breast like swelling or any redness we see in either of the breast, or if there is any nipple discharge which is apart from the breast milk which we see, and if there is any pain which can be considered, and also any palpable lumps or nodules which we can palpate by hand. That is all. These are all the main symptoms which we usually find.
Today we will be talking a few things about the screening techniques. Diagnosis and prevention can be done by the screening tests. The screening tests include the self-examination and clinical examination by a doctor from the age of 30 for those who come under the high risk group and with a family history of cancer, breast, etc. And next is the mammogram. Mammogram is not feasible in a country like ours to be used as a screening test, but after doing the self-examination, if there is any doubt the doctor wants, he'll be writing the mammogram. And next is the FNAC, that is fine needle aspiration tissue cytology is done, and the other is true cut biopsy. These are all the methods which are used for the screening and diagnosing the cancer tissue by doing the histopathological exam also.